IATF Special Medical Advisor Anthony Leachon believes that the enhanced community quarantine in Luzon has been effective. However, in an interview with One News's Agenda, Leachon says that the DOH must first record all outpatient cases of COVID-19 in the country to get a clearer picture of how we are faring in the battle against the SARS-like disease.
We have a lower recovery rate, though the picture that we see in the Department of Health, because these are absolute numbers, when you compare with the rest of the world, we're actually lower than the rest of the world because we were surprised and, of course, overwhelmed. And the Department of Health has opted to monitor only the cases in the hospital because, in reality, Sito, we also monitor those cases in the outpatient and as whether they improve or not. But in the Philippine setting, since our documentation are basically the hospital, so we expect deaths in the hospital, and we expect that because of the prolonged stay, an average to flat the epidemic curve. And I think New York right now is plateauing, going down. And I think we need to see the figure, the epi curve.
Leachon also warned against drastically lifting the ECQ in Luzon. At this time, the ECQ is scheduled to be lifted by the end of the month. The task force is now discussing post-April 30 scenarios.
There's a tight balance between health and economy. Without the infrastructure in place, like the mass testings, and then, of course, the readiness of the COVID hospital so that we can open the tertiary hospitals, this might actually cause problems when hindi ready pa, and basically because of the clamor of the business community, it might be detrimental to do that. So the best approach would be perhaps Luzon. I discussed it with Secretary Galvez. Will be on ECQ with phase down, and then essential workers, and then PCR will be still ECQ up to the May 15, and then localize with cities in the national capital region.